Dengue fever.
Febrile phase usually lasts for 2 to 7 days, characterized by high-grade fever with myalgia, arthralgia, headache, and skin rash. Mild hemorrhagic manifestations like skin petechiae will be there, and tender hepatomegaly and leukopenia are features in febrile phase. Critical phase lasts for 24 to 48 hours, where fever is reducing, but there is progressive leukopenia and reduced platelet count and increased hematocrit due to plasma leakage, pleural effusion, and ascites will be there. And recovery phase 48 to 72 hours, gradual resorption of fluid from extravascular space into intravascular space, followed by diuresis and improved uptake and general well-being. How to assess in OPD? What is the date of onset of fever or illness, and how is the oral intake and warning signs, mental state or lethargy, urine output, tongue or axilla will be dry, hemodynamic status include BP pulse and capillary refilling time, and tachypnea and acidotic breathing or pleural effusion, abdominal tenderness or hepatomegaly or ascites, rash or any bleeding manifestations or tourniquet test. So, dengue plus warning signs with or without warning signs. Severe dengue is due to plasma leakage and severe hemorrhage and severe organ impairment will be there. So probable dengue is live in endemic area with fever and two of the following criteria: nausea, vomiting, or rash, or aches and pains, and tourniquet test positive, or leukopenia, or any warning signs. Laboratory confirmed dengue important when no signs of plasma leakage is there. What are the warning signs? Abdominal pain or tenderness, persistent vomiting, and clinical fluid accumulation, mucosal bleeding, and lethargy or restlessness, liver enlargement more than 2 centimeter. Laboratory signs include increase in hematocrit concurrent with rapid decrease in the platelet count. Severe plasma leakage leading to shock or fluid accumulation with respiratory distress is dengue shock syndrome. Severe bleeding as evaluated by clinician and severe organ impairment, liver AST or ALT more than 1000 and CNS impaired consciousness and heart and other organs. What are the investigations we do? CBC, there will be WBC, decrease in WBC along with platelet decrease and hematocrit is increased due to plasma leakage. NS1 and IgG and IgM. NS1 initially it is positive, IgG and IgM, later it will be positive. So dengue fever, there will be decreased platelet count along with decreased WBC, whereas malaria platelet count will be low, but WBC is normal or low. CRP in case of malaria will be high, whereas CRP in case of viral infection like dengue is normal. Bacterial infection CRP is high in case of typhoid fever. And malaria, there will be normal or low eosinophil count, whereas helminthic infections, there will be high eosinophil count. So based on this, we categorized Group A, B, and C. Group A is no warning signs and able to take oral fluids and pass urine 6th hourly. How to manage these cases? Bed rest, plenty of oral fluids like ORS and coconut water, and avoid excess plain water as it may cause hyponatremia. Paracetamol 500 to 650 milligram per dose. For high fever, dosing should not be less than 6 hours. Tepid spawning like tap water if patient still has high fever. So we should not use cold water because it may cause vasoconstriction and decrease in the fever will not be prominent. Tap water should be used. Avoid painkiller like ibuprofen and diclofenac. Report to doctor if bleeding or vomiting or severe abdominal pain or breathing difficulty or not passing urine more than 6 hours occurs. Group B is coexisting dengue fever with coexisting pregnancy, infancy, old age, diabetes or renal failure or chronic hemolytic disease or living alone or in far to reach places. If the warning signs are absent, then give oral fluids and maintenance IV fluids. How to give maintenance IV fluids is normal maintenance is holiday cigar formula 4 ml per kg per hour for first 10 kgs body weight, followed by 2 ml per kg per hour for next 10 kg body weight. and 1 ml per kg per hour for subsequent kg body weight. For suppose 50 kilograms is the weight of the person, first 10 ml 40 mg per kg followed by 22 ml per kg 20. Next remaining is 30 kgs weight, so 30 ml per kg. So total include 90 ml per kg per hour. If the warning signs are present, do baseline hematocrit and give isotonic fluid 7 ml per kg per hour for 2 hours, followed by 5 ml per kg per hour for 4 hours, followed by 3 ml per kg per hour for next 4 hours. Hematocrit same or slightly elevated, continue with 3 ml per kg per hour for another 4 hours. If the hematocrit is rising, leak is happening and increase the crystalloids to 5 to 10 ml per kg per hour for 4 hours. So what are the fluids we give? Normal saline, sodium is 154 and chloride is 154. Initial resuscitation fluid is normal saline with or without hyponatremia with normal chloride levels. Chloride level should be 100 to 110 millimole per liter. So ringer lactate has less sodium than NS. So sodium is 130 and potassium is 4 and chloride is 109 less chloride than Ms and lactate is 28 millimole per liter. If there is hyperchloremia, increased chlorine, we should give regular lactate and hyperchloremic acidosis, in which cases this lactate in the body it will convert it to bicarbonate. Group C is severe dengue. So with severe dengue, with hypotensive shock, where we have discussed with BP less than severe dengue, systolic BP is less than 90 and pollen from base of more than 40 millimeter and baseline pulse pressure is low, that is less than 20. If there is hypotensive shock, give 20 ml per kg crystalloids or colloid over 15 minutes. If there is improvement, crystalloid or colloid 10 ml per kg per hour for 1 hour, then crystalloid 753. 7 for 2 hours, 5 for 4 hours, then 3 for 4 hours. If there is no improvement, do hematocrit. Hematocrit, if it is increasing, that means there is leakage. Give colloid 10 to 20 ml per kg per hour over up to 1 hour. If there is improvement, then switch to crystalloids. If there is no improvement, then do hematocrit. If the hematocrit is decreasing, so we need to do blood transfusion. Usually, what is the target of IV fluid? After we give IV fluid, we have to check capillary refilling time. If it is less than 2 seconds, or urine output should be 0.5 ml per kg per hour. Caution: retrieve the IV fluids at the end of critical phase. If the urine output is more than 0.5 ml per kg per hour, adequate oral intake and hematocrit decreasing in stable patients. The hematocrit is decreasing in a stable patients. Means the leak will be less and hematocrit is decreased. If the compensated shock is there, we have to give crystalloids. Crystalloids 10 ml per kg per hour over 1 hour. If the improvement is there, yes, we have to give 753 ml per kg to 4 hours. If the improvement is not there, we have to do hematocrit level. Hematocrit level, if it is increasing, we have to give colloids 10 to 20 ml per kg per hour. If improvement is there, we should switch it to crystalloids. If there is no improvement, we have to do again hematocrit. If hematocrit is decreasing, packed RBC 5 to 10 ml per kg body weight and whole blood 10 to 20 ml per kg body weight and platelet. If only transfusion to prevent bleeding when given less than 10,000. So before discharging, we have to look for whether no fever for 48 hours, improvement clinical status, general well-being, update, and hemodynamically stable, adequate urine output, and no respiratory distress. Laboratory criteria: increased strength of platelet and hematocrit is stable without IV fluids. No benefits. Corticosteroids, recombinant factor, immunoglobulin, tranexamic acid, interleukins, papaya leaf, aloe vera, goat milk, arak. No benefits. Daily checklist during hospitalization 4 to 6 hours include body temperature, respiratory rate, heart rate, blood pressure, capillary refill time, and temperature of extremities, abdominal pain or vomiting if there are bleeding episode. Differential diagnosis in case of dengue. Dengue fever with non-hemorrhagic loss. Viral causes include measles, rubella, and HIV seroconversion illness, and meningococcal leptospirosis and scarlet fever. Dengue hemorrhagic fever, bacterial enterohemorrhagic phase of leptospirosis, and Ebola, yellow fever, arenavirus, etc. Undifferentiated fever, viral influenza, chikungunya, infectious mononuclear infection, bacterial enteric fever, and typhus. Parasitic include malaria. So, hemodynamically unstable means admit. Stable with no bleeding, no warning signs, no comorbidities, OPD. Stable with warning signs, admit. No bleeding, but with warning signs, admit. Stable with bleeding, admit. Thank you.
To get anywhere in life, you have to work extremely hard and you have to be disciplined. If you wanted to be a great piano player, there's no drug you can take, there's no self-help book, there's no guru. You got to spend 5 years, 10 years learning it until it becomes something that's second nature. There are no shortcuts. But if you learn that from an early age, like 10 years old or whatever, you see after a few years that an incredible pleasure happens where now you have mastery of this piano and you can play things you could never play before. Suddenly the whole thing opens up, this whole new universe. And that's the paradigm for everything meaningful in life. If you learn something well, if you learn a craft and you master it, it can bring you a far greater pleasure than any kind of drug or any kind of going out to a party or socializing. But you have to be patient and you have to not be afraid of boredom and you have to not be afraid of the effort.